The Food and Drug Administration has issued a warning that osteoporosis drugs given to women have been linked to very unusual femur fractures. The femur is the long bone in your thigh. The warning was issued in 2010 and includes an entire class of drugs known as bisphosphonates. Bisphosphonates include drugs like Fosamax, Actonel, Boniva, and Reclast. As a result of this warning, the manufacturers of bisphosphonates have changed the warning labels on these drugs. In some older women, their bones thin and become brittle. Osteoporosis is the medical term for thinning of the bone. Advanced cases of osteoporosis can lead to fractures in the spine and the hip. Bisphosphonates were developed to stop the progression of this disease. But it now appears that these drugs were given to a lot of women who did not even have osteoporosis. Evidence exists suggesting that drug companies push the drug for women who only had osteopenia. Osteopenia is a loss of bone mineral density and is normal for most older women. Not every woman who has osteopenia will develop osteoporosis. In addition to pushing these drugs for conditions other than osteoporosis, it appears the manufacturers promoted the long-term use of these drugs. In many cases, women taking bisphosphonates fracture their femur when doing something as simple as getting out of bed or stepping off of a curb. We represent a woman who unfortunately fractured both of her femurs at the same time. Treatment for these fractures often requires placing a metal rod into the femur and long-term rehabilitation. The FDA based its findings on 2 studies that suggest that women who took bisphosphonates for more than 4 years were at increased risk for experiencing these unusual femur fractures. In these 2 studies, it was found that of the 300 women that experienced atypical femur fracture, over 90% had been on the drug for more than 5 years. Most experienced groin and thigh pain for weeks or months before they suffered the fracture. This newly reported risk associated with taking osteoporosis drugs comes on the heels of numerous reports of jaw osteonecrosis and esophageal cancer being linked to this class of drugs. The FDA is currently investigating reports of many women who have been diagnosed with esophageal cancer after taking bisphosphonates.